Now, the measurement of visual acuity is done using a Snellen's chart, and this is a Snellen's chart. Snellen's chart's first line is 660. So, this indicates that each letter subtends, each letter that you see here will subtend an angle of 5 minutes of arc at the nodal point of the eye. So, this is the principle of the Snellen's chart. And Snellen's chart is the most important apparatus that we use to record visual acuity. And the numerator of the charts, for example, in this 660, there can be 660 or 636 or 624, 618, depending on whichever line you're reading. And finally, you reach the line of 66 and then 65. So, whenever you see a patient who has a particular visual acuity which has been recorded, usually the numerator is, all these are the numerators indicate the distance at which the patient is being tested. That means the patient is made to stand at 6 meters and is being tested. And the denominator indicates the distance at which the letter can be read normally. So, this is the denominator, distance at which the letter can be read normally, but that is why we test for visual acuity, to assess where at 6 meters at which level the patient is able to read. Now, apart from this, you also have Landolt-Seyring test or E-chart, where these letters, Snellen's is mixture of alphabets, but you can also have it in numerals, or you can have it in as a C chart, where each area is given as a C, so the patient can identify, or an E chart where each is a different orientation of the E. Okay, so of course every type of Snellen chart will have to subtend an angle of 5 minutes. So, this principle has to be respected in all constructions of the Snellen's chart, but nevertheless, for patients who are illiterate or uneducated, when it's difficult for them to identify alphabets, we use these kind of symbol charts. So, tests for vision in children, for all these are for distant vision that I just told you, Snellen's chart, etc. You also have something called a Logmar chart, and for near vision, we also have specific condensed Snellen's chart that is used for, or a Jaeger's chart that is used for near vision. Test for vision in children is preschool or in infants. In preschool, we use Sheridan-Gardner, or we use Steiker screening test, or we use a K-picture test. Whereas in infants, we use optokinetic nystagmus, that is, nystagmus is the to and fro oscillation of the eye. So, based on that, in infants, it is hard to actually quantitate the visual acuity, but we can assess the extent of visual acuity that the child is able to use at that time. So, an optokinetic nystagmus is when you pass an object in front of the patient's eye, the ability of the eye to display to and fro movement is an optokinetic nystagmus, or you can have preferential looking test or blink test or Menis reflex. So, all these tests will indicate whether the child's eye and visual apparatus has developed or not.